Hi, it's Thor again with Massage Umbrella doing passionate, creative, and intentional body work as well as self-care. Today, we are going to talk about a common pain pattern that I see as a massage therapist that specializes in pain management therapy, and that is sacroiliac joint pain. SI joint pain is an inflammation or irritation of the ligaments that attach the lower spine to the pelvis. This pain pattern can arise from a tendency of one side of the lower back to be more dominant, so those muscles take on more of the workload, while the muscles on the other side stay in a weak and shortened state. Today, I want to demonstrate some techniques that we can adapt to our self-care routine and bring home with us that can really manage these symptoms as well as get us on the road to recovery. One more note about SI joint pain is that it is commonly mistaken with true sciatica because those symptoms can mimic sciatica, and anytime we feel that pain in the low back that refers down the hips, it's a common mistake to just jump straight to sciatica, but this is a different dysfunction and can and should be treated differently. The first self-care technique that I'm going to teach today to help manage SI joint pain is the pelvic clock. The pelvic clock is similar to a pelvic tilt, if you're familiar with that movement, and it can be done in a laying down position, preferably to start, and modified to be executed while you're sitting down or standing up as well. So the point of the pelvic tilt is just to give that SI joint pain soothing, healthy movements to condition the nervous system to accept healthy, pain-free movement. So what you're going to do is find a comfortable place to lay down. You're going to picture your hips as a clock. So the top of your hips, that being maybe the top of your sacrum, S1, being 12 o'clock up here, and the bottom of your pelvis, the pubic bone down there, being 6 o'clock. So imagining we're rocking up and down from 12 to 6. So 12 with the anterior tilt, 6 with the posterior tilt. I'm going to do each position 3 times. 12, 6, 12, 6, 12, 6. And now I'm going to move around the clock. I'm going to go to 1 o'clock, and the corresponding time at the bottom would be 7. So 1, 7, 1, 7, 1, 7. Go to 2, 8, 2, 8, 2, 8. I'm really just imagining in my head where these numbers are. It's not a perfect science. The important thing is to get the isolated movement in your hips. The last one would be side to side. Not the last one, but the last one I'm going to show here is 3, 9, 3, 9, 3, 9, and so on. So by the end, you're going to have gone all the way around that clock, all the way back up to 12. A helpful note about the pelvic clock that I mentioned before is that it doesn't have to be done in a laying down position. Many people like to stand against the wall so they can feel their hips moving against the wall. My favorite is to do it while I'm sitting, specifically when I'm driving, because the driving position is one that can trigger that SI joint pain if it's already present or irritated. So pretty much just adapt it to your lifestyle and find those spots that feel good, and you can repeat them even more. Everyone has those numbers on the clock where it's like that aha moment, like that I'm hitting the right spot. So make it your own and have fun with it. Our next self-care technique that we're going to cover is lower back extensions. Lower back extensions can help with SI joint pain because it conditions the muscles and nervous system to work together and not favor that one dominant side, and that is going to lead to more healthier, pain-free movement. So for this one, you do need a flat surface to lay down on. You can easily do it on the floor with a yoga mat, or just find a comfortable bed. So what you're going to start with is raising your chest off the floor, kind of in a Superman position like that. Hands, let me move down so you can see it better.
chest, and hands off the floor or table in a Superman position. And repeating that 5 times. The next one you're going to do is isolating the lower body, raising the feet. Doing that 5 times. Now keep in mind, you want to be engaging your lower back muscles to create this movement. And the last one is bringing them both together. So I don't know if I can get this in the shot, but I'll be raising my feet and my hands together for 5 more repetitions. Now this is a little bit more challenging, so build your way up to it. I'm breathing pretty hard right now, my heart rate is elevated. So keep in mind you might want to start with 3 reps, even 1 or 2 reps. Find a comfortable way to start so it's easier and more accessible to your routine. So on top of the strengthening and nervous system reconditioning we're doing to help relieve our SI joint pain, it's also vital to be stretching on a regular basis. You want to be targeting all your surrounding muscle groups near the low back, especially the hips, because that's going to relieve tension in the surrounding muscle groups and also stimulate more circulation to the area, which is going to help relieve the inflammation and clear up the pain. One muscle group that I think is most important to stretch when experiencing SI joint pain is the hip flexors. They're located in the front of the hip, and they perform hip flexion, bringing the knee to the chest, basically. So when they're tight, it causes a lot of impingement in the low back, which can result in this dysfunction that we're talking about today in the sacroiliac joint. Basic hip flexor, one of my favorite hip flexor stretches I'm going to show today, isn't the only one you can do. I'm sure many people know more that can be used, but this one is easy to teach and easy to learn and repeat on a daily basis. So what you're going to do is get down on one knee. You want to do it on both sides, but maybe really target, isolate, give a little bit more time to the side where you're feeling the pain. So you want to be down on the knee that you're stretching, the side that you're stretching. You're going to be feeling the stretch right in here in the hip flexor, and the other foot's going to be about 3 feet from that back knee. What you're going to do is lean forward till you feel the stretch right here, and your knee's just going to about be covering the front of your front foot's toes. Lean into it, and like any stretch, you want to visualize the muscle you're stretching while taking 3 to 4 deep breaths. After that, remain in this stretch position, and you can throw a little enhancement on top of that just to get a little bit more, squeeze a little bit more juice out of this nice stretch. So what you're going to do is take the elbow of the side that you're stretching and place it on the opposite knee. Take your opposite hand and place it on your low back. What you're going to do is twist till you can see that side or back wall. As you're doing this, you can lean a little farther in that stretch or just do what feels right. By throwing that lumbar twist in it, you're getting a stretch in the low back as well as the hip flexor at the same time. Now, for the purpose of demonstration, I'm going to show the other side. Down on that knee. And there it is. That's a hip flexor stretch that I love, that you can take home with you and do it on a daily basis. The final self-care technique that I'm going to show to help manage and treat SI joint pain is the most challenging. So definitely modify in the beginning and build your way up to it.
This is really isolating the muscles on one side of the back. We're isolating that and building up the strength to get it used to doing just as much work as the other side. So, what we call this move is the pistol squat. We are going to stand on one leg, the leg that is the side where we're feeling the pain, and we're going to hold the other leg up by our foot with the corresponding arm on that side. So make sure you have a table, some sort of a support next to you that you can lower yourself down and then come up nice and comfortably. It's okay if you rock back in the beginning. That's part of building our strength up, and then you're going to need to push up off the floor to get enough strength. Eventually, you want to be building up enough strength to be strong enough to hold yourself in that squat position on one leg and then come up on your own. This is challenging. I'm digging deep for this. So the reason being is I've had my own troubles with SI joint pain and have had to use these methods for myself to try to get out of it and live a better quality of life. So I can tell you from my own experience, this stuff does work. It takes time and it takes effort. The bottom line with all these exercises and self-care techniques is to modify them, adapt them to your routine, and make it something fun and easier to do every day than something that you dread and don't look forward to. Eventually you want to get to the point where you are doing 3 sets throughout the day, maybe morning, afternoon, and night. But in the beginning, just start slow and do what your body is allowing you to. With that being said, it has been a pleasure to have the opportunity to share this passionate, creative, intentional self-care to the community, and I hope you're able to adapt it to your lifestyle and use it to your benefit. Thanks a lot. Bye.